I'm Dr. Manuel Astruc. I'm a board-certified psychiatrist. I help entrepreneurs who are suffering from depression get back to being energetic, productive, and very confident. So what is depression? Depression is a medical illness that is characterized by a persistent problem with your mood regulation. Your mood is abnormally low or sad most of the time, and you can't just get yourself out of it. How do you diagnose depression? In psychiatry, we use a manual called the Diagnostic and Statistical Manual, and it's got a bunch of versions that have happened over the years. Many years ago, before we had what we call the nomenclature, the language of how to describe what we were treating and what we were seeing, people in America and people in Europe and people in other parts of the world would be treating illnesses and they would be calling it depression or schizophrenia, but they didn't have really a common language of what that meant. So we got very standardized, and the DSM now defines depression with a set of symptoms, and the criteria have to be present for 2 weeks or longer. There's 8 symptoms that we look for, and you've got to have at least 5. And of those 5, one of them has to be either persistently decreased mood or a persistent problem with motivation, lack of motivation, or difficulty with a lack of pleasure. You'll also see that there's problems with appetite, so decreased appetite, losing weight, or increased appetite. There can be disturbances in sleep. We'll also see disturbances in how you can think, like people's thoughts get slowed down. Physically, they get slowed down. Energy levels drop. One of the things I hear commonly from patients is that it's really, really difficult to get out of bed. People will have difficulty with concentration and focus. So reading, being productive at work, goes right out the window. People feel worthless. They have these feelings of guilt that are not really realistic from the outside. The person, when they're experiencing the guilt, when they're depressed, they have every thought that it's realistic. When people's on the outside looking at that individual, they're like, you're carrying way too much. This is not appropriate to the situation. And finally, people can get actually suicidal thoughts. They start to think that life isn't worth living. And at the worst, the suicidal thoughts can actually lead to suicide attempts. But the fact that someone's having a thought doesn't necessarily mean they're going to take action on it. But it's one of the serious consequences of depression is that people can actually die. One of the questions I get from people is, where does burnout fit in when you're looking at depression? And the way that I look at this is that depression is a continuum. So we talked about the criteria for depression. It's got to be present for 2 weeks or longer. You've got to have 5 of the following 7 symptoms. What happens if it's present for a week and a half? It's not diagnosed as depression yet. What if you only have 2 or 3 symptoms? It's not diagnosed as depression yet. So there's a continuum of symptoms from mild to moderate to severe. At some point we cross a line and you're actually depressed. And I think that burnout, which is diagnosed by the World Health Organization as an occupational syndrome, is an early stage of something that can bloom into depression. According to the World Health Organization, there's 3 symptoms for burnout. One is exhaustion. Second is feeling detached and disconnected from your work, or bitter and cynical around your work. And finally, there's a sense that you're no longer effective at work. So those symptoms you can see are very much correlated with depression. They just haven't led to the full syndrome, where there's more difficulty in your ability to function. But left unchecked, it's not unusual that we'll see burnout lead to depression. Where does anxiety fit in with depression? And there's two ways to look at this. One is that some folks have pre-existing anxiety disorders, so they tend to be someone who is worried about things, making mountains out of molehills, and they can't just turn it off, and it's always present, and then they get depressed. Another scenario is that you're not someone who has an anxiety disorder, but when you get depressed, part of your depression is very commonly going to have an increase in depression. So there's more obsessing and fretting and worrying. You'll see mental struggle, right? Mental worry, and you just can't turn it off. And you'll also get physical symptoms of anxiety. So that's like having adrenaline running through your body when there's no cause for adrenaline. And what happens to someone who gets depressed? When we've looked at large groups of folks and we follow them over years, there's some numbers that come to light. If you suffer from one episode of depression, it gets treated, the depression goes into remission, you get treated for an adequate period of time. So what we usually recommend to people is that after they get better from their depressive episode and they're back to baseline, back to themselves, that we keep with treatment for, and the treatment I'm talking about is medications, 6 months to a year in order to not get another episode of depression. So you treat for an adequate period of time, someone's in remission, and then you stop the medication. So for folks who have had one episode of depression, the chances of having a second episode after they've gone into remission with adequate treatment is 50%. If we follow that second group, the 50% who have a second episode, treat them, get them into remission, adequate treatment, stop treatment, that second group, 75% of them is going to have a third episode. And if you follow that along, they stop the medication, the chances of having the next episode goes up into the high 90s. What that means is that for some individuals, depression ends up looking more like a chronic illness, something that recurs and that we expect to continue with maintenance treatment indefinitely. And for others, that's not necessarily the case. Now, that being said, one of the things that's important to recognize is that when we talk about even something like 75% or 95% chance of having another episode come back, that means that there's 25%, 5% of people who may not get another episode down the road, even for folks who've had multiple episodes. We don't know who they are. But if you're working with somebody, a psychiatrist or your primary care doctor, and you want to try stopping your medications, it doesn't mean that you can't. It just kind of gives you a large framework from other people's experiences of what the odds are for having another recurrence. How common is depression? Right now, what I tell folks is that depression will affect about 20% of the population over the course of their life. So 1 in 5 people is going to have a challenge with getting a clinical depression over the course of their life.